Well, I am a speech-language pathologist, and I divide my career into before neuroscience interventions and after. Before neuroscience interventions as a speech pathologist, I could work with any child who had any kind of a speech issue, and we call those now, the term that we're using is sound production problem issue, or an understanding of language issue or grammatical usage issue. And I could work with that child 2.5 hours a week, 2 hours a week, and make marked improvements in speech skills, in language skills. But before we had tools like Fast ForWord, it would take me years if I had a child who was severely impaired. So if I had a child who came to me with no speech and language, let's say at 2 years of age, by the time the child was 5, I could have them speaking in sentences. I could have their speech sound productions totally corrected so that they were intelligible. I could have their grammar good enough that they were speaking in sentences. But it would have taken me those 3 years or 4 years to get them there, and the child would still have problems when they got into school learning to read. Once we had Fast ForWord, what happened is you still need the speech therapist. You're still going to have someone work with the child directly. But it was like getting a booster shot where I was getting the child accelerated to the point that the therapy was easier and it was going faster. So what Fast ForWord does is it makes speech therapy work better. It's not a substitute. It makes it work better. And it makes it more effective so that what we do as speech-language pathologists is more lasting, and the child can utilize what they get from the speech therapist when they get into school so that they continue to accelerate. So I have children now that I worked with 15 years ago who some people thought were never going to talk again. I had one little boy who went to Mayo Clinic, and the parents were told he will never speak. You're going to have to get him an augmentative system. He had a severe neurological impairment called agenesis of the corpus callosum. I had other children that it was said they would never read, they would never be successful. And all of those children now, I have the benefit of seeing the combination of Fast ForWord and my speech therapy. One just graduated from a major university. He was diagnosed with autism spectrum disorders, graduated from a major university and is studying to be a rabbi. I have another child who graduated from a major university who's getting his PhD in psychology. He's so fascinated with this. And I have other children who are doing very well academically and doing very well in the business world after graduating from high school. So speech therapy is effective. Fast ForWord just makes it more effective.